This is the procedure for drawing blood cultures from a tunneled catheter. The procedure is similar for a PICC line or an implanted port. The procedure is explained to the patient, and the nurse has washed her hands and dried with a paper towel. Supplies have been assembled on a clean surface. For a PICC line, a new positive pressure cap and an extension should be assembled with a saline flush to prime. For a tunneled catheter or port, you will only be priming a new positive pressure cap. Set aside for later use. Cleanse the tops of the culture bottles with alcohol and allow to dry for 1 to 2 minutes. They should not be cleansed with povidone iodine, as this interferes with the results of the tests. The nurse will now put on a pair of gloves and remove the tape from the junction of the cap and the catheter. The junction is cleansed with 3 alcohol swabs, wiping for 1 full minute. If it is an open-end catheter, it should be clamped prior to removing the cap. The cap is then removed, and an empty 10 milliliter syringe is directly attached to the catheter. At this time, the catheter is unclamped if it's an open-end catheter. Withdraw 10 to 20 milliliters of blood as dictated by the amount listed on the culture bottles. Clamp the catheter if it's an open-ended catheter and remove the syringe. Attach a 10 ml saline flush to the catheter hub and insert the contents using a push-pause motion, stopping at the last half milliliter. Clamp if it's an open-end catheter. If necessary, cleanse the threads of the catheter with alcohol to remove any blood from the threads. Attach the new primed positive pressure cap. Unclamp the catheter if it's an open-end catheter, and insert the contents of the second 10 milliliter saline flush in the same manner. You will follow with a final flush with heparin if the catheter is open-ended. Do not clamp the catheter at this time. This will allow the positive pressure cap to work properly. Transfer the blood from the syringe to the culture bottles, filling the anaerobic bottle first, then the aerobic bottle. Remove gloves and tape all connections. You will note that we did not withdraw a waste sample when obtaining the blood culture. This is important to remember, as the greatest colonization of bacteria will occur in the hub of the catheter, and we need that as part of the initial sample. Document the procedure in the progress note, including the amount of blood withdrawn for the lab tests, the tests that were ordered, as well as the amount of flush solution administered. Just to review, if the catheter is valved, there is no need to clamp during the blood draw procedure. If the catheter is open-ended requiring heparin, the catheter should be clamped whenever the cap is removed from the line during the changing of syringes and the lab draw. This concludes the procedure for obtaining blood cultures.